is Diagnosis Glaucoma with your hosts, Dr. Mona Kaleem
and Dr. Harry Quigley.
Greetings! Today we're pleased to have one of our research fellows, Delcora Huggins, with us, who is going to talk about AutoDrop aids. And these are aids and devices that are useful for people who are taking glaucoma medications. Delcora is a third-year medical student at the University of Cincinnati who has been spending a year with us as a research fellow. Delcora, can you please tell us a little bit more about yourself?
Sure. Good afternoon, everyone. Like you said, my name is Delcora. I am a third-year medical student at the University of Cincinnati. So I first got my introduction to medicine as a child. So my younger brother actually has sickle cell disease. And so growing up and watching him suffer from a chronic condition, spend a lot of times in hospital, I was kind of interested, like, hey, what are all these cool people doing? So that's kind of where I got my first introduction to medicine. I actually went to Johns Hopkins for undergrad. And so I majored in neuroscience while I was there. Got really excited about the brain. And then I also got a master's in biochemistry and molecular biology because I wasn't sure if I wanted to do neuroscience or stick with studying sickle cell, like I said, because my brother had it. So went and got that master's, realized I liked the neurosciences more. And so then we applied to medical school. Applied to medical school, got accepted into Cincinnati. And so I've been there for the past 3 years. And so when you start med school, they always tell you that the first thing you have to figure out is whether or not you like being in the operating room, if you want to be a surgeon or not be a surgeon. When I first started, I didn't actually think I wanted to be a surgeon. So it was definitely a surprise when I had my surgery rotation and then actually loved it. So if you know anything about a neurosurgeon, it's a very demanding career. They work a lot. They have really tough cases. And I was kind of looking more so for a good work-life balance, but then also still being involved in neuroscience. And so that's how I landed on ophthalmology. And so when you're going in medicine and applying to residency, you always want to put your best foot forward and learn as much about the field as you can. And so that's how I ended up back here at Johns Hopkins doing a research year.
That's actually really interesting because I was also very interested in neurosurgery as well. And I think a lot of people who go into ophthalmology had a similar interest. And one thing that's pretty exciting is that, I always tell people when you look into the back of the eye at the retina and the optic nerve, you're actually looking at one of the cranial nerves. So I say you're looking at the brain in a very indirect way, but you're looking at the brain. And, you are actually the first student that we've had on the podcast, which is very exciting because you are doing your research here with me and you've been fantastic. And we're really excited about this topic. A lot of patients with glaucoma use medications and struggle with the use of medications. And we're going to have a great discussion about adherence issues, barriers, and what are some tips and tricks that you recommend to help with that. So, Delcora, can you tell us a little bit about some of the problems that patients have using eye drops?
Sure. So just understanding, the use of eye drops and problems that patients have had has been something that's been researched and studied for years. Some of the research goes back to the early 1990s. And so some of the things that most commonly patients will discuss is one, just forgetting, life happens. We all get busy, have other things that come to the forefront of our mind. And so sometimes we honestly just forget to take our drops. Other things that come up is that sometimes with those of us that have advanced glaucoma, we end up having to take multiple medications. And so sometimes having a complex regimen where we're taking multiple numbers of drops, it can be kind of confusing. So sometimes that's one of the issues that a lot of patients describe as a barrier. Another thing could just be a lack of understanding, especially in today's society where we all have the 15-minute appointments with our doctors. Sometimes we don't get a chance to ask all of our questions and make sure that we have a proper understanding about our condition and about the medications that we're using. So lack of understanding is also a common barrier. Another issue, which is common across all of medicine, would be the cost of medication. We all have different socioeconomic backgrounds and other things that life require us to pay for and contribute to. So sometimes just a medication is too expensive for us to afford. Another common issue that we'll actually get into a little bit later is difficulty with drop administration. So I won't touch on that too much right now. Other barriers would be life stress, side effects from medications, and then mistrust of physicians, which we are working very hard to dispel currently.
These are all very important issues because in the clinic, sometimes a patient comes in and their eye pressure is too high or their disease is advancing. And we ask them, are you taking your medications? And I don't know if there's kind of like this pressure to say yes, or what it is, but it seems like patients just kind of want to say, oh yeah, I'm taking all of my medications, and oftentimes we find that that people do miss a drop here and there, and it's hard for doctors to understand. Well, why don't you take your medications? But when we have this discussion and we think about some of the barriers, these are all such important issues that we maybe don't acknowledge. In addition to the adherence issues, there's also difficulty just with using the eye drop, so with drop administration. Delcora, can you kind of talk about the research you've done with drop administration, some of the barriers with drop administration also?
Yeah, so difficulty with drop administration just kind of gets into the physical aspect of things as far as like issues with the eye drop bottle. So for instance, for some patients that have arthritis or things like that, the bottle might be hard to open, or it might be hard to squeeze the bottle. Some patients mention that because you can't actually see your eye, it's kind of hard to aim the bottle to make sure that the eye drop is actually getting into the eye. As patients get older, something that they often mention is having poor hand-eye coordination. We also have different reflexes. So patients will mention that they flinch or blink when something is coming towards the eye. So even though we know that, we're supposed to be taking this eye drop to help us with our condition, we can't actually prevent our body from doing what it's supposed to do in protecting our eye and blinking to keep things out. And so, of course, with any advanced eye condition, you run the risk of having decreased visual acuity. So then not being able to see also makes it harder for us to administer our eye drops. Having any sort of mobility issues, limited hand dexterity, these are all issues that contribute to us not being able to put our eye drops in our eye successfully, making it harder for us to manage our glaucoma.
There's actually a very good video online. It's our colleague, Dr. Henry Gempel. The video is on YouTube, and it's on the topic of how to administer your eye drops. So he actually shows the proper technique, which I think all of us, the doctors, are a little guilty of not really counseling patients appropriately. But the best technique is some of the things you had talked about, but basically tilting your head backwards, trying to lower your eyelid and put the drop in the lower part of your eyelid, having someone help you with the drop, but of course they have to try to keep your eyelid held open. And then after you get the drop in, to do something called punctal occlusion, where we just kind of hold right where our eyelid and our nose meet. That's the tear drainage canal. And if you hold that area for about 2 minutes, you can actually keep the drop in your eye and prevent it from going down your nose. One of the things that people complain about is a bad taste with the eye drops, or that it goes down their throat, or they're having some secondary side effects. And so if you do that punctal occlusion technique, it really decreases that from happening. So Delcora, what are some potential solutions to these barriers?
So one thing that we've definitely started and are always working to improve is just the educational materials that we put out there. So the resources that we have online, the resources that we keep in the clinic, such as brochures, pamphlets that we have available to discuss with patients. If you're ever unsure about something and you feel like you don't have the time to ask your doctor, ask if they have these handouts. This might be a good way to get that information, or ask if they have an online resource that they can reference you to, so that way you can still have access to this information, even if it's not that one-on-one interaction with your doctor directly that we're sometimes looking for. If one of your issues is that you're not understanding the complexity of your regimen because you're taking multiple medications, reach out to your doctor about not understanding, so that way if they're able to, they can simplify your regimen, or we can work on making sure that you understand which medications to take when and how much, things like that. If one of your issues is forgetting, which I am always a victim of myself life gets busy and then I forget things, set reminders, whether it's, on your phone, because we all have phones on ourselves this day and age, whether it's, using a written chart where you have your eye drops that you're supposed to take and you go in and just put an X on it, where every time you take your medication for that day, you put an X by it so that you're tracking your medication to help with forgetfulness. That might be one option. For those of us that have issues actually getting the eye drops in our eye, we can always ask our friends or family members to help us if they're readily available. That one's sometimes tricky because if you live alone, there's not really anyone to help you. But if they are there and they love us and want us, to be healthy and well, most of the time they're willing to help us. And then you actually mentioned the video from Dr. Jampel. So another thing that we as clinicians can improve on is making sure that we are teaching proper drop installation techniques. And then you all as patients and then friends and family members, like she said, can go watch the video on YouTube that kind of walks you through it. If you need like a refresher or this is information that you haven't heard before, it's definitely a good resource that's out there. And then the last thing that is the headline of our conversation today would be the drop aids.
I thought it was interesting that in research studies that have been published, as many as 50% of patients are not using their drops correctly. In your lit search on this topic, did you find similar numbers, or what were some of the things that you found in terms of statistics?
When I was doing my research, what I came across was about 2 papers that discussed patients and their improper technique installing their eye drops. So one of the papers showed that 80 out of 116 patients had improper techniques. So that's about 69% of patients were not using their eye drops properly. And then the other one showed that 46 out of 85 patients, so about 54% of patients had improper technique. And so with these research papers, when they were looking at improper technique, what they were looking at or defined improper technique as was patients that instilled more than one eye drop at a time, patients that just missed the eye, or patients that ended up accidentally touching the eye drop bottle itself to the eye or the area surrounding the eye that we call the adnexa. So this research showed about, in one paper, 68%, and then the other 54% of patients were not properly instilling their eye drops. So this is definitely one area where we have room for improvement in helping our patients.
And in your research in this area, you also found a lot of great information about the current day drop aids or bottle dropping devices that can be used. Can you just tell us a little bit about each one that you found out about?
Sure. So drop aids have been around since the early 1990s. That was when the first one came out. And they definitely come in many different shapes, styles, and forms. The main goals are always to, of course, improve our aim and the success of drops being installed in our eyes. But depending on the device, it'll have a little bit of a different style and then mechanism depending on what the target action is. So for 4 devices that are currently available today would be the AutoDrop, the AutoSqueeze, the GentleDrop, and the NanoDropper. So we'll just tackle them one at a time. So the AutoDrop can be found online from Amazon, or you can actually buy it from your local Walmart. It runs about $10. And so this device in particular is meant to help with aiming, improving aim, and then making sure that the eye drop itself is getting in the eye. So how this device itself works is that there's a little keyhole slot that's at the bottom of the device, and we'll put like graphics and pictures for everyone to see. Like there was a handout that will go with this because I know it might be hard for people to visualize what I'm saying, so that way you can actually see what I'm talking about when you guys look. But so there's a keyhole slot that's at the base of the device, and what you're going to do is you're going to twist off the cap of your normal eye drop bottle, your medication, and so you'll twist that cap off and you'll place that keyhole slot around the neck of the bottle. And so then the device itself actually folds over top. And so when you fold over top, there's a socket that has the eye drop in the center, and then the device is actually around it. And so with that, this keeps the device from the eye drop from coming in contact with your eye. And then it helps with aim, because what you'll actually do is set that device on the orbits around your eye. And so Like I said, it helps to improve the aim by ensuring that the eye drop itself is actually getting in the eye, and then also helps to prevent some accidental trauma by us touching the eye drop bottle to our eye itself. Next drop is the AutoSqueeze. So the AutoSqueeze can be found, again, from Amazon, online at Amazon, or from your local Walmart. It costs about $10, just like the AutoDrop. So for this one, the bottle just sits in the center, and then there's two wings on the side, and you basically just squeeze both of them, and it puts pressure on the bottle until your eye drop comes out. So this one is really good for people that have difficulty squeezing the bottle itself, because it just makes it a little bit easier to get the eye drops to come out, because sometimes those eye drop bottles are a little hard to squeeze.
This is one of my favorite ones. I'm not here to sell any products or anything like that, but when people, I have a lot of patients who have hand contractures or issues squeezing, or say that the bottle has become really rigid, and so I do recommend this for them. And what's the next device you wanted to talk about?
So before we go to the next one thing that I will mention is that both the AutoDrop and the AutoSqueeze can be combined. So for patients that have issues, like you said, with both squeezing the bottle and then with also ensuring that the eye drop gets in the eye, you actually can combine these devices and use them both together. So that way you can kind of tackle two of our barriers at once. The next device that we're going to talk about is called the GentleDrop. This one you can find online at Amazon, or also from their website. So the website is www.dropbetter.com. And so it costs $20 at both Amazon and from their website. This device, there's a portion of the device that sits on your nose, and then there's a sleeve through which you would insert your eye drop bottle. And so, like I said, the portion that sits on your nose is just to help stabilize the eye drop bottle, so that way we can ensure that the medication is actually getting into our eyes. And so just like we mentioned earlier with proper eye drop techniques, so you're going to place the device on the bridge of your nose, you'll tilt your head back, and then you would just squeeze your eye drop bottle as you normally would, and it'll help ensure that the eye drop that is coming out is being aimed properly into our eyes.
Yeah, this is one of the newer products that I've seen. I know there was an article in one of the ophthalmology journals called actually Ophthalmology Glaucoma, where they had done a study looking at the use of this device. And I know that there is another one that you were going to talk about also.
Yeah, so the last device is called the NanoDropper. And so this one is also one of the newer ones out there. And so this one can be found on Amazon for $25, or it can be found at their website, www.nanodropper.com, and it's $20 from their website. So this one is very interesting because unlike our other devices that we've talked about so far, where we've really been focused on the barriers of physical difficulties with administering our drops, this one more so gets towards the side effects. And so you have mentioned how sometimes patients will sometimes taste the medication after administering their eye drops. This is one of those devices that were made specifically to address those issues. This device is a cap that sits on your normal eye drop bottle. So you would just take off your cap that normally sits on your eye drop bottle, and you would twist the NanoDropper counterclockwise until it's snugly on top of your eye drop bottle. And then what you're going to do is pull sideways and up to remove the cap, and then administer your eye drops the same way you normally would. So tilting your head back and ensuring that you're just squeezing over your eye. And so the difference with this one is that a smaller amount of medication is going to come out. And so the goal of having that smaller amount of medication come out is that it's actually going to decrease the systemic side effects of taking our eye drops.
I know that there have also been some nice publications on the NanoDropper, and this device, again, it's I think it's a great advent. All of these different devices that we use to help administer the drops, they're each useful in different ways, which is one of the nice things about them. But I do like that this one has like that soft tip on the end of it. And otherwise, are there any other devices that you haven't told us about yet, Delcora?
There's always new devices out, but we won't bring them to you guys until they've been fully researched and supported by good evidence.
And you did mention where patients can get these devices if they're interested. We'll also create a handout that we post on the Diagnosis Glaucoma website where you can look at pictures. Again, we're not here to sell any products. We're just here to deliver information to you. And what do you think are some of the benefits of using these drop aids?
Like I mentioned before, when I was kind of going through some of them, the goal, of course, is always to improve our aim, to make sure that we are getting our medication where it needs to go to help control our eye pressures. So, of course, that's number one. Some of the devices help us with decreasing our blinking reflexes that we kind of talked about earlier. The AutoDrop and AutoSqueeze kind of help with gripping and squeezing the bottle, making that easier for us. All of them are very good at helping us decrease the risk of touching the bottle tip to our eye itself, because we don't want to accidentally cause us any injury to ourselves there. And then, of course, with our NanoDropper, the main goal is to decrease those systemic side effects. But then also one of the other benefits is that it decreases waste, because we are actually getting a smaller amount of medication. So our medications actually last us a little bit longer.
All right, great. I think this has been a very helpful episode. And I know, Delcora, that you are getting ready to write some articles for some journals. So if patients are interested in learning more, they'll be able to see your article in an upcoming eGleams, which is a publication from the Glaucoma Research Foundation. And I know you're also writing an article on this topic for doctors. So thank you so much for all of your work in this area. And Delcora, we want to wish you the best of luck in finishing medical school and in your bright future as an ophthalmologist.
Thank you. And hopefully all of the patients, friends, and family members out there find this information useful.
All right, excellent. Thank you, Delcora. Have a great day. And to all of our listeners, thanks again for tuning in to some more great information. We have more episodes coming up on exciting topics throughout the year. Take care.
Thank you for joining us. Until next time, your mom says take your drops.